This is Minda Wilson with Urgent Care, and I'm excited to welcome Dr. Joseph Mosquera to our program. He is an integrative medicine specialist who is very interested in reducing the cost of care, which is one of my passions. Welcome, Dr. Mosquera.
Thank you very much. Thank you.
So I understand that you're very family oriented. You practice out of the home you grew up in. What made you decide to become a doctor?
Well, I grew up in an inner city community in Newark, New Jersey, very diverse cultural area, and I came over when I was young with my family from Spain, and I began actually working at the local pharmacy and becoming interested in health and science. And so from there, I ended up in medical school, and I happily came back to the community to practice. And that's where I also learned about the importance of cultural medicine, or integrative medicine, where you learn about the different traditional techniques, what works, what doesn't, only because I have treated so many patients from so many varied parts of the world whose belief systems and approach to medicine are all very interesting but different.
So can you give me an example of that, of how one culture would be different from another, how you would treat them differently?
Oh, absolutely. So even though they're both, say, Hispanic cultures, a patient from Bolivia would be quite different than a patient from, let's say, Guatemala or Mexico. Their culture is both have the same language, but their background in terms of a lot of Indian customs and botanical plants would be more so in, let's say, Bolivia, with the use of specific botanicals, whereas Guatemalan culture is sometimes medically based on a little bit of brujeria, which is a type of witchcraft medicine. So understanding their views on these their different perspectives is important for me when I take care of them.
So by providing a cultural setting, you make them more likely to respond to the treatment. Is that how it works?
Yeah, absolutely. Being able to communicate with these different patients from cultures is paramount. And I use my training in integrative medicine, which really looks at the intelligent combination of Western medicine with traditional medical systems. And I've studied for many years what works, what doesn't. For example, acupuncture, nutritional therapies, botanical therapies, lifestyle modification therapies. These all sort of are aimed to empower the patient and to rely less heavily on our sort of drug prescribing healthcare system that is both costly and sometimes dangerous and often not effective.
Yes, because people don't always stick to their medication regimens.
Yeah, they sure don't. And a lot of it is due to cost. About a third of patients that I see simply can't afford their medications and they never get them. So you really have to instruct them on preventative lifestyle modifications to treat themselves. And it's just so unfortunate the way medications, including generics, have skyrocketed in the last 10 years. And, we write so many prescriptions in the United States. I think the estimates are 4 billion prescriptions a year. That's about 11 prescriptions or more per patient every year in this country. And many of them are not needed, in particular antibiotics that are overused when there's viral illnesses, a lot of medications with side effects. But certainly people who have high blood pressure, diabetes, who need medications are really facing financial hardship because many of them can't afford it. And what I've done is created a drug-saving app and website, is particularly directed at bilinguals, called Sureceta, SURECETA.com. And the patient can go on there and get a coupon and save up to 80% on their prescription, which makes it affordable and at least palatable cost-wise for the patient.
And it allows them to comparison shop in an area, so they can find out what's available near them. And
exactly. It's I guess that data term is it geolocates within a 5, 10, or 15 mile radius, and it's amazing when you do it because you realize how prices vary so much. A single medication, just say something to lower your cholesterol, the generic version of Lipitor, can cost within a 5 mile radius for 30 a month supply. It can cost $40 in one place, $75 in another, $130 in another. Only within a 5 mile radius. So what this app does, the Sureceta, is it the lowest price and provides you with a discount up to 80% on that price.
So I understand that there's an increasing percentage of the Hispanic community that is uninsured. Is that true? Since the passage of the Affordable Care Act.
Yeah, I mean, the Affordable Care Act has covered, luckily it's covered a lot of patients who've qualified for Medicaid type plans in their states. But beyond that, it really hasn't, it's failed to cover, when it comes to, say, bilingual Hispanics that come from up to 30 countries from around the world, perhaps out of the approximate maybe 55, 60 million, 1/3 are entirely uninsured. The other third are either poorly or virtually not insured. So you only have about 1/3 of that population that is reasonably insured, and affordability is important. And that's why also on my site, I put a location of urgent care centers wherever they are around the United States, that instead of going to an emergency room and possibly receiving a bill that could easily bankrupt most patients, they can go and geolocate an urgent care center for a reasonable fee. A lot of these urgent care centers have risen and multiplied exponentially in the last few years as a result of the chain pharmacies like the Walgreens, the Walmarts, and the CVS's of life are going into that business now, where they have these ambulatory care centers. But it does it provides people with a quick access, affordable way to take care of their sore throat or check their blood sugar, blood pressure, and at a fraction of the cost of an emergency room.
Do people find that there's a language barrier when they go to these services? Are they able to get services in Spanish?
Yeah, there are. I mean, there are certain states where the services in Spanish are excellent. Certainly, mostly out west. If you go to, certainly in California's and Arizona areas, I find that it's much better. In the Northeast, the Mid-Atlantic states, and in the Midwest, there is a lack of bilingual services. And many of these patients, especially bilinguals, the millennials, do speak both languages, and they're often the sort of caregivers, if you will, and assistants to explain everything to their parents, the middle-aged and older Hispanics, where Spanish is their primary language.
So when you treat people, I understand that you treat them out of the home you grew up in. How did that evolve?
Yeah, I do. Well, that's where as you're saying, I grew up in that home. Went to locally in high school. When I came back from medical school, I saw a great need there. It's a community that I understood. This is going back to the 80s, and at the time there was a huge crisis called HIV/AIDS going on. It was a real dark moment in healthcare in terms of the way patients were both being treated and access to care. And I went back in those times to do what I was trained to do, and to provide care for those families. And I've stayed there ever since. Really enjoyable and an honor to take care of the people in the community.
I understand you've created a family business. Your mom works there. Your wife, your kids.
Yes, exactly. My I've had my children involved, and My wife is often my assistant and runs a lot of the show, and my mom, who's in her mid-80s now, actually sometimes takes care of keeping the office running. And so it's exciting to be involved like that as a family business, as you say. And patients respond really nice, and it's a great learning experience for all of us to be able to communicate with our patients within a community structure, because integrative medicine and the approach is all about mind, body, spirit, and also community.
So I'm sure it feels good when you're not feeling well to go to your quote unquote home and sit in the waiting room. Know you're going to be seen and taken care of and respected and listened to. I'm sure that's an important part of the services that you offer.
Absolutely. And all the things you just mentioned should really be the norm of healthcare. Unfortunately, it's rapidly disappearing in this healthcare environment, which really isn't a healthcare environment. It's a financially motivated disease management system rather than healthcare system. And it's unfortunate. And so the days of, I grew up with the Dr. Welby's of life, and that typified my aspiration to really be that type of doctor, as I'm sure many doctors want to be as well. But it's very frustrating today for a lot of physicians out there, and very challenging.
So what do you think can be done to change that? Well,
it has to begin with, I'm a great proponent of coming up with some type of universal care. Everyone here, we all deserve the same care as our congressmen, as our senators, who really fail to pass the right legislation all the time. So I'm hoping the day does come when we can put together a care that provides equal access for everyone. I think something like what we have is a Medicare system, which has been successful, but nationalizing it to all citizens with some type of agreement between employer, government, and citizen to put X amount of dollars that's related to their income, and having an equal platform that everybody has to access to care. Because what I see, it's very simple. It's very much like our legal system. If you're wealthy and can afford a high, these platinum plans or whatever, you do have access to great centers and great care. But if you're a working class citizen and on the lower end of the income scale, your access to really good care it's really unaffordable, and that really has to be corrected and equalized.
So, do you feel then that as President Trump came out today and said that pronounced the Affordable Care Act a failure, and he and do you feel that that's true?
Oh, absolutely not. The best part of the Affordable Care Act was people always call it the Affordable Care Act. It was actually called the Patient Protection and Affordable Care Act. And that patient protection was never done before. And that is where you can have insurance despite pre-existing conditions. You're covered until a certain age, and there's no limits or caps on if you have a serious illness that your insurer should provide. So, those protection mechanisms that were in Obamacare were greatly applauded by physicians, I'm sure, and the healthcare community. Affordable, that name should not have probably been in there, because it hasn't been affordable the way it's set up, because it's set up so that money's always got to come from somewhere, and there's always someone dissatisfied. But certainly the patient protection mechanisms were, I was so happy to see them. So I think, like all these large legislative breakthroughs that we deal with, our politics, there's some very good elements and some not so good elements. But certainly our present administration should keep those good elements that I mentioned and work on that. I don't think that they so far, the the HSS secretary that he really has failed to put forward any enticing, intelligent proposals to help healthcare. And I have yet to see it. I often send my suggestions, but they fall on deaf ears because I don't get politically involved. I'm a physician trying to help patients.
So do you feel that in terms of integrative medicine, what do you feel are the most important things that patients can do for themselves to keep themselves healthy?
Lifestyle management. And under that lifestyle management, understanding what the risks are, learning about nutrition. I would start with nutrition. I'd go from nutrition to exercise, understanding your risks, making sure you're getting your vaccines for you and your family, making sure that you undergo the preventative testing, over 50 colonoscopies, mammograms. I think a preventative approach and a lifestyle approach is essential. If you do that statistically, you're going to greatly improve your health chances of not getting these chronic illnesses that are so both debilitating and costly to our system. I think something like 75-80% of our healthcare dollar is spent on chronic illness, cardiovascular disease, neurovascular disease, and cancer and arthritic problems. That's where all our money goes. And all four of these major disease states are preventable by a great extent. Most experts agree up to 80% of them can be prevented, which would give us a surplus in the field financially. So I would really emphasize, and I still do to every patient, tell them what they have to do to rely less on medication and more on themselves to manage their health.
But Hispanic culture especially focuses on a diet that might not be the most healthy. How do you get people to change that?
Yeah, well, methodically, with a little bit at a time. As you're mentioning, a lot of carbohydrates are ingested, and this is a population with very high rates of diabetes and obesity in general. In fact, the generations that come over are heavier and have higher diabetic rates once they go into the American diet. And there's a lot of reasons for that. A lot of patients that I see are working class people who simply don't have time to exercise. They can't afford the better foods at times. They find it difficult to go shopping without buying, down a center aisle, all the processed foods for them and their kids, or they go to fast food places. It's sort of a lifestyle that they not so much choose, but it's what's there for them. So I spend a lot of time educating them on alternatives, on trying to eat more of a plant-based diet, trying to eat less processed food and less carbohydrates. But you sort of have to take it a little bit at a time. Each time they come, I give them a sort of another caveat to take home with them and their family, and it works. But it's a challenging process for sure for many reasons.
Do you feel that there should be incentives for people to maintain a healthy lifestyle and disincentives for people who don't? Do you think that would be effective?
I do in large corporations and large companies where they have the cost of healthcare. There's been studies that have been done out of Stanford, a few other. Duke did a study where that has worked. Incentivizing members of a corporation to achieve an optimal weight, give them time to go exercise, explain nutrition to them, have them go to some wellness conferences, learn things like relaxation therapies, like meditation, mindfulness-based stress reduction. These have worked. So my answer would be yes. Now, that's really white-collar corporate who are usually better educated and have both the time, and they're within a company that can do that. My concern is I deal mostly at times with the construction worker. There has to be cultural sensitivities of their lifestyle and how to approach that. A construction worker really has to be instructed with a different approach. They may not have time during the week. They have to carve out time early in the morning before he goes to work or on weekends. So nutrition is especially important. Other habits that run rampant amongst workers, like drinking, smoking, you really have to approach those. So there's different risk factors in different populations, and that's where being a physician that's trained in both cultural medicine and integrative medicine is important.
And for those kind of people, the middle income, lower income people that are not doing white collar jobs,
right.
There's also like stretching or opportunities like that would improve their overall level of fitness.
Absolutely. Simple things. For example, I'll give you an example of that with men. They often suffer from back pain only because of the labor tasks that they do, and they often have muscular ligament problems, disc problems. So simply while they're taking a shower, taking an extra 30 to 60 seconds of stretching. I teach them a stretching exercise they could do in or out of the shower of holding a pose, sort of a yoga stretching pose, for example. Also letting them know that they shouldn't have that large meal when they get home because they're often tired. They eat like their huge calorie meal at the end of the day, which they shouldn't, how to space that apart. And also I teach them breathing exercises and relaxation breathing exercises that they can do during their breaks to minimize the stress at their work.
So given that there are a lot of opportunities for people to sort of make small changes, do you think there's incremental changes seem to be the most effective? So do you have a way of guiding people through the incremental changes that they need to make in order to ultimately end up at a healthier place?
Yeah, I certainly do. It begins with individualized care, understanding that individual from a mind-body standpoint and what they've gone through and what their lifestyle is like and what's possible. Mm-hmm. I start with thinking of what's possible. Then I begin really with nutrition is probably the first thing I begin with. And it's often a great place to start that people do have some control of. And we go over the concept of calories and good calories and bad calories and the amount of calories without getting too technical. So I begin there. Once we achieve and stabilize the nutrition, I think they're getting into specific exercises and mind-body stress reduction is the next step. And once we cover that, both the mind and body and nutrition, I think we're on our way to a person that's empowered to follow through and prevent disease.
If people want to reach out to you or contact you, what's the best way for them to do it?
There's two ways. Thank you. One is on my normal website, Dr.Mosquera.com. My name is spelled MOSQUERA.com, or on sureceta.com, where I have those useful tools that we were mentioning about drug savings and urgent care finders. And that's spelled SURECETA.com. And literally that translates to your prescription in Spanish. In English, it doesn't really come across, but in Spanish, it's su receta, which is your prescription. And it's fully bilingual, by the way. And so it's in both languages. All the articles and all access there is bilingual.
I think what we've learned today is that it's that small changes, taking care of yourself, your diet, your body, and making even incremental changes can make a healthier person, and that there's opportunities for people to take a path to wellness using integrative medicine, even if they aren't on that. And the other thing is that there's an opportunity to compare the cost of your prescription drugs so that you can take advantage of lower cost prescription options. And people that are interested should contact Dr. Mosquera. This is Minda Wilson for Urgent Care.